Your bill.
Thank you. Thank you, Madam Chair, members of the committee. It's wonderful to be here before you once again. For the record, Nicole Macri, State Representative from the 43rd Legislative District. And I want to start off by talking a little bit about my motivation for doing this bill. As I think some of you are aware, I am very interested in ensuring that we can expand access to healthcare to the greatest extent possible to our residents here in Washington State. And an essential piece of being able to expand access is to both understand and manage the costs related to our healthcare delivery systems. And we know that access to information is key to understanding where those cost drivers are. We also know that hospitals are a significant portion of healthcare expense. In fact, in December, CMS at the federal level issued a report that hospital-based care equals about 33% of total healthcare delivery costs. And hospitals play a significant and unique role within our health care delivery system. They are our safety net, and they are an essential piece of healthcare delivery. So as public policymakers, we have a unique interest in understanding how care is delivered within the system and where the costs are. And as our healthcare delivery system has shifted over time, what we see is more integration of different types of health facilities within broader systems. And so having outpatient clinics affiliated with hospital-related healthcare systems, having ambulatory surgery centers that are affiliated with hospitals are things we see more and more. And these things can be very positive, right? Because we can ensure more cost-efficient care when it's done on an outpatient basis or in an ambulatory surgery center than a hospital system. But because our financial reporting information right now is really based on these old ideas that these systems are separate and not fully integrated, we, I think, need to modernize our reporting so we can have better insight. I, outside the legislature, am an employer. I have about 700 employees of the organization I work for. I have negotiated a lot of health care, health insurance contracts on behalf of my employees. And I know the stress that all employers go through every year when those costs of healthcare go up. As public policymakers, I think it's incumbent on us to have insight into what those cost drivers are, so that way we can ensure affordability for all of our constituents. So this bill has several sections, as you heard about. I'm very grateful to all the stakeholders, including and especially the hospitals, who really helped to refine the bill to this point to ensure that we are minimizing any redundant information, and that we are honing in on the most relevant information that will provide us new information to make decisions. So let me talk an example about a health system that's in my district. Swedish healthcare system currently reports to DOH. In 2017, they reported $710 million in other direct expenses, so aggregated into this other category, $710 million. This bill seeks to disaggregate some of that information based on the areas of most frequently high costs within the hospital, and if you look at the bill, you can see what those categories are. As we do work around transparency, and we've done this in other areas, we need to balance the need and desire to better understand the information with the administrative burden that this will place on our health systems. And we've tried to very carefully strike the right balance here. I think you'll hear different testimony today as to whether or not we've struck the right balance there, but that really has been my intent. As it relates to community benefits, several states do require more detailed reporting than we do in Washington State, particularly the IRS form requires reporting about what the strategies are relative to the community needs assessments, but what were the deliverables and what dollars were spent relative to those strategies, there is not very robust reporting, and I think we have a public policy interest in understanding on how those dollars flow and what the results are, and so that's what the bill does in that regard. And on the bad debt, we have not heard stories in Washington State, thankfully, but we have in other states where hospitals have profit sharing or other revenue generating interest in debt collection agencies, where debt collection agencies can be subsidiaries of hospitals. So they're not only recovering their debt, but they're making a profit off the repayment of debt. And so we just want to bring transparency on that. We're not asking for any financial information. We are just asking for a public assertion as to whether or not hospitals have such a relationship with the debt collection organizations that they're using. And to the question, Senator Becker, that you asked about the independent ambulatory surgery centers, I will say the interest there is in understanding as we shift health care delivery, many more procedures being done in the ambulatory surgery centers that used to be done in hospitals. We're asking for information really about what are those services. We don't capture those anywhere where public policy makers can have a good look at them. The original bill as introduced really wanted to look at all the financial reporting, but the ambulatory independents are not really set up to collect that kind of information, and I appreciate the burden that would provide. So we really are focusing here on the patient services, and then if organizations are making significant capital investments into diagnostic or other equipment, just having an understanding of that at a high level. We did a lot of work to protect our safety net hospitals in rural areas, and this is why you'll see different standards for the Soul community hospitals, because we understand that the big guys can have more leeway in being able to do this kind of reporting, and our small little rural hospitals don't have that same capacity. So the goal really is to equip all of us to better reach, I think, a shared goal that we have, which is that to ensure that our constituents, wherever they are in the state, can receive the care that they need in a timely and affordable way. So with that, glad to take additional questions here or offline.
Thank you, Representative Macri.